Welcome to Real Talk with Dr. V. This is a very special Sunday morning broadcast on loose skin after weight loss surgery. A lot of patients are concerned about this. Is that true? If it's true for you, you can put it in the comments section, okay? So what I'm going to do today is talk about loose skin, and then I'm going to talk about some myths versus some truth about loose skin after weight loss surgery, and then I'm going to give you some things that you can do about it. All right, let me remove my books. I'll leave those up for now. Okay. Loose skin. So let me think about how I want to approach it. Okay. I'm going to give you some truths. Let me do some truths first, I think. Truth number one. And, you really want to take notes for this, okay? Actually, you know what? I'm not going to do this. Let me do it this way instead. Okay. So this will be non-surgical. And then surgical. All right, we're going to talk about surgical and non-surgical options. Okay, I think I do want to do it this way. So number one thing regarding loose skin after weight loss surgery, most people, and when I say most people, I'm probably saying more than 95%. Most patients will have loose skin. I mean, they will have it. So the first thing I want to tell you is this, don't think that somehow you're going to get around doing this. You're not going to trick it, right? There's nothing you can really do to avoid this. Now, some of it depends on how you carry your body weight. But by the time you have to have weight loss surgery, you have just gotten too big. So you're not like the mom who has 30 to 40 pounds to lose after being pregnant, and if she drops those 30 to 40 pounds, maybe she's young and maybe the elasticity of her stomach will go back. Maybe, but maybe not, right? But by the time you need weight loss surgery and you're 100, 150 pounds overweight, 100 pounds overweight is a BMI of 40, by the way. So someone commented that their BMI is 43, so you're over 100 pounds overweight. To 150 pounds, you're going to have loose skin. And even if it's not in your tummy area, you're one of these patients who have maybe a small midsection, but you carry all your weight on your hips or your arms, you're going to have bat wings. You're going to have saggy skin between your thighs. You're not going to avoid it. You're going to have some loose skin in some part of your body. It could be your neck. We have patients that have these really thick necks, and they start losing weight, and they're like, oh my God, Dr. Vuong, I've got a neck again, but now I have this hanging skin right here, right? So most of y'all are gonna have something to do with loose skin. So the first thing I'm gonna teach you is this, to try to ignore it, to try to do like a ton of ab crunches or a little bicep arm curls will not get rid of your loose skin, okay? So you have to prepare. So that's the first step I want you to do, is prepare for it. So all you that are pre-op, you're not going to get away from this. I need you to prepare for it, and that's what I'm going to teach you about how to do that in this broadcast, okay? How to prepare for the loose skin and what you can do for it. That's the main purpose of this talk today. How are you going to prepare for it? All right, now, let me move these down. The number two thing I'm going to tell you is this. People go, well, I don't want to have weight loss surgery because I don't want to have to deal with loose skin. Or they'll say, I don't want to lose too much weight. That way I don't have to have all that loose skin. That is BS. That's bullshit, man. That is like you trying to justify the reason why you can stay obese. I know that sounds harsh, but it's true. It's subconsciously you're doing it, right? You're a nice person, but subconsciously you're self-sabotaging by saying, I don't want to lose weight too fast, so I won't have loose skin, okay? So the thing I need to tell you is this. You got to get there first. I mean, you've got to lose the 100 pounds first before you start worrying about loose skin. Does that make sense? You got to get there first. Because many times you're not going to get there. If you listen to other programs, if you believe other people, if you believe your stinking thinking, you won't get there, right? I want you to get there, right? I'm trying to help you to get there. So you got to get there first. Some patients will use this as an excuse to not even have weight loss surgery. They will like bail on their weight loss surgery, not go through with a surgery because they're scared of loose skin. So they stay obese, they stay with sleep apnea, they stay with their diabetes, they stay eating their junk, and they never even get to the loose skin, right? Or some patients have weight loss surgery and say, I want to be realistic, and they stay at like 175 pounds. And I'll go, but you're only 5'2". You should be 120 pounds. You haven't lost enough. But Dr. Vuong, I've already lost 100 pounds. But you haven't lost enough to worry about the loose skin yet. Does that make sense? Like, I push my patients really hard, and I'm happy for this because we are really getting to the point where we have accelerated how fast people are losing weight. They're starting to need weight loss surgery. The plastic surgeons are very happy with us. We're starting to see patients needing weight loss plastic surgery a lot sooner than other programs. We're going to talk about that here in a little bit. So you got to get there first. Now, it's a badge of honor because you did it. You need to wear your loose skin like a badge of honor. You did it. You're one of the very few patients who lost all the weight. So now you're deserving of plastic surgery. Wear your apron like a badge of honor, man. Show off your bat wings like a badge of honor. I love it, right? For my patients, I love it because I know they did what they were supposed to. They got there, and now we've been preparing them on how to afford plastic surgery, right? So that's important. You need to be proud of this. Don't be ashamed of it. Don't think like, I don't want to lose too much weight. I don't want to have... You are going to have the loose skin. So what we're going to do is talk about how you prepare for it. Okay? So when you've had weight loss surgery and you've had this massive weight loss, plastic surgery is the only option. Is only option to remove it. You will not exercise off your loose skin. So, exercise will not do it. Doing a bunch of ab crunches will not get rid of your apron. Okay? And the reason is this. It's because, let's say this is a person, right? All happy here. And they're obese, and they have this central obesity, right? Maybe they have a big bottom too. And that's a side view, right, of a person. I know that looks terrible, but now let's say they lose weight. Now once they lose weight, this big abdominal skin now just hangs down like that. I know it's drastic. So now you have your loose skin. It's like if you imagine a balloon, and you hold this balloon to your belly. Y'all see me? You hold this balloon to your belly and you deflate the balloon like that. Now you have like two edges of the balloon. That's your loose skin. So what you need to do is have a plastic surgeon pick it up and cut it off. Does that make sense, y'all? So this is just like a loose skin, like a layer of clothing, like an extra, like that, extra layer of clothing hanging off your belly. Will do, and look underneath here, will doing tummy crunches get rid of this loose skin? Answer is no, because the ab crunches are working muscles, not skin. It won't fill it out. It won't get rid of your loose skin. It will not work like doing bicep curls or tricep kickbacks or any of that stuff will not help with the bat wings. Doing exercise is good to tone your muscles, to give you strength, to make you feel better, to make you more efficient at burning calories, to keep you stronger, to keep you from falling down. Yes, all that's true, but it will not get rid of loose skin. Okay? So exercise will not work for loose skin. It just won't. So what do you have? First, you got to get there first, and then you got to prepare for plastic surgery. Now, some people say, well, Dr. Vuong, if I have plastic surgery, all my problems will get better. The thing I want to tell you about this, Give me a big star on this one. Y'all give me a big star on this one. Plastic surgery, now pay attention now, watch me now. Plastic surgery will not make you look the way you think you're gonna look in your head. Someone put that in the comment section for me. Plastic surgery will not make you look the way you're imagining it in your head. That's very important you understand, okay? Will not make you look, not make you look perfect. Does that make sense? It will not match the image of yourself in your brain. Doesn't matter if you have the best plastic surgeon. It doesn't matter if you go to the high-end Beverly Hills. It will not make you look, all right? Because what you're doing is you're exchanging that loose skin apron for scar. Because you're trading loose skin for scar. Trading for scar. For scars, and multiple scars, right? So even if you have the bat wing, you're going to have a scar on the underside. A good plastic surgeon will try to hide it underneath your arm. You're going to have a bikini line scar. You're going to have a new belly button scar, okay? So even if you have plastic surgery, it will not make you look the way you think you should look in your head. So you need some of these other non-surgical options. All right, so what are those things? Some of those things are like creams. So the cream is not going to get rid of the apron, right? But what the creams will do, like this one, I'm going to send one of these out, all right? Like these creams will like help with your stretch marks. Will help with maybe some lumpy and bumpy areas, right? Maybe it will help with that neck thing. So even if you have plastic surgery on your apron and your arms, well, what are you going to do with the neck area? What are you going to do with the inner thighs? Right? So it's not going to make you look like how you think you're going to look inside your head. That's really important, y'all, because this causes a lot of psychological damage to patients. I mean, I think that right there made this broadcast worth it for you, right? That it will not be the body you have in your brain. So you need this other stuff. So you got creams, you've got some non-surgical things like ultrasound waves and something called cool sculpting. So you need to go to usually a plastic surgeon has these available in their offices. It's non-surgical. So the ultrasound waves, this has been out for a few years now, uses ultrasound to like kill the cells, the fat cells, and then the fat cells die and your body clears them away. So the fat cells actually die. So these are for trouble spots. So let's say you have a tummy tuck and maybe there's like a pooch on the side or maybe it's not quite as tight over that troublesome lower abdominal area. You know what I mean? Like then you would need some ultrasound waves or cool sculpt to like work those troublesome areas, right? These are usually about 4 or 5 treatments. Cool sculpt uses cryogenic therapy, so cold temperature directed at fat areas has been shown to kill those fat cells, and so then your body clears away those fat cells, right? So they've had good results. Now this costs money. Your insurance isn't going to cover this because this is more cosmetic, but it's going to get you closer to that image you have inside your head. Does that make sense? It's going to get you closer. These are non-surgical outpatient procedures. All right. The ultrasound. Oh, I meant to tell you. So these things kill fat cells, but also promotes collagen growth. I'm running out of space here. Collagen growth. So it does a couple things. It kills the fat cells, but it also, collagen is what gives our skin like its elasticity. And as we get older, we lose, unfortunately, some of our collagen. And the sound wave, the ultrasound waves, like stimulates your body to build more collagen. That helps with elasticity and the overall look of your skin and your body. So you're going to like that a lot better. But you got to get there first. Okay, you got to get there first. And then the other thing is, it's kind of a hybrid, but it's more plastic surgery. But liposuction, I'll make a little 5. That is a surgical procedure, but that's to sculpt things out. Liposuction will like maybe hit your trouble, some sides or the little extra handles on your hips, things like that. A plastic surgeon will do that. That's not for weight loss. If you have friends or loved ones who are trying to get liposuction to lose weight, that's not good. Liposuction is good for body, what's called body contouring. So even after you have your tummy tuck, your skin removal, you still might need trims. Does that make sense, y'all? You might need additional work. Okay. So what I want to do is erase this and talk about, okay. All right. I'm going to talk about, does your insurance cover plastic surgery? Does that make sense? I want to leave this down here because it's so important. You got to get there first before you start making excuses for why you shouldn't do it. Okay, so let's talk about insurance real quick. Do me a favor and share the broadcast right now because a lot of people are worried about insurance, covering this, and I want to talk about it real quick. I'd like to talk real quick about whether or not insurance covers your plastic surgery, your skin removal surgery, okay? So what we're talking about is after you've had weight loss surgery and you have a lot of loose skin, like your hanging panis, like that hanging apron, or your bat wings, okay? So after weight loss surgery. And remember what I said, you will have these issues. If you've had to get to the point when you need weight loss surgery, you will have loose hanging skin, and the only way to get rid of it is to have plastic surgery. There are 2 problems with this, okay? One is insurance coverage. Will my insurance cover it? And the vast majority is usually no. Usually no, okay? But there are ways that we can try to fight it for you, all right? We have to, I'm going to write this in red because this is important. We have to explain to the insurance company that it's not cosmetic. I want y'all to write these reasons down, okay? Because sometimes your plastic surgeons and your program doesn't understand this. Your loose skin, your hanging apron is not a cosmetic procedure to have it removed, right? You have to document, so this is document. You have to provide your program, your surgeons, your plastic surgeons, with this sort of documenting. It's affecting your health. Like, for example, your hanging apron is causing back pain. Causing back pain. It's causing back pain. It's causing rashes and like fungus infections underneath. The little fold? Fungus infections. So you need to document this. So you need to take pictures. As weird as that sounds, you need to hold up your apron and have someone take a picture of your rash or go see your doctor. So when you have something like this, don't ignore it. Go see the doctor and have them document it. Have them take a photo. Because then you can use this to send it to your insurance company and say, hey, this is a medical issue. It's not cosmetic. Does that make sense? That will help you right then and there. And it could be rashes under your armpits. It can be under your skin fold. It can be inside your belly button. It can be between your thighs. Those are painful. Oh, that's the other thing. Pain. Redness. These are things you want to document. All right. Now, in New Mexico, I currently live in New Mexico. We were lucky enough, if you have Medicaid, we got Medicaid to cover the skin removal surgery after weight loss surgery. Think about that. Now, don't be hateful now. Don't be like, I have private insurance and they don't cover it and you got Medicaid to cover it. Like, yeah, man, we did, right? Because, well, it's just important. I won't go into the we were lucky. Our group of surgeons, like the bariatric surgeons in the state of New Mexico, worked with New Mexico Medicaid and explained to them why weight loss surgery was important. And so they approved that. And then we explained to them why they need to cover the skin removal. So usually we can get the tummy tuck and the bat wings taken care of most of the time. They won't cover like the neck stuff, and I don't think they cover the thigh stuff unless it's really bad. So we were really fortunate, right? Some states cover that. Some states Medicaid will cover it. Some states won't, all right? So you have to do this sort of documenting. That's important, okay? Number 2. The other issue you have is plastic surgeons. Most plastic surgeons, rightfully or wrongfully, I don't know, most plastic surgeons do not take insurance because they know that it's not worth their time to try to fight all of this stuff. Most plastic surgeons will not take insurance. Now, we are very fortunate in New Mexico. We have University of New Mexico and one plastic surgeon in Santa Fe and one in Albuquerque that I'm aware of takes insurance and tries to help patients, right? So we have some access to plastic surgeons, but depending on where you live, most of the plastic surgeons won't take insurance. So even if you have this covered, you fought, good luck trying to find a plastic surgeon. You guys see? You see the problem? Right? There's not availability. Well, shit, Dr. Vuong, that sucks. So this is why you're watching this broadcast. I'm going to show you how to get ready for this. Would that be valuable to you? If I showed you how to get ready for this, would that be worth your time? All right? I think that's all I want to say about that. And I need to go back to reminding you, it's a badge of honor. You got to get there first. And plastic surgery is not going to make you look the way you think you look in your head. So, how do I pay for it? For plastics. How do I pay for plastic surgery? All right. Now, when you're looking into plastic surgery, you need a plastic surgeon. Someone asked me, what about a dermatologist? Y'all know the difference, right? A dermatologist is not going to be able to handle your loose skin. And you need a plastic surgeon. And specifically, you want someone who is familiar with massive weight loss. Right? Don't go to the plastic surgeon that your cousin went to get her boobs done. He's not used to dealing with as much skin and the fluid shifts and the drains and all the, bigger complications that could happen with massive weight loss. So you need a plastic surgeon who's used to doing full body lifts, who's used to spending 4 or 5 hours with you on the operating table, right? Who's used to dealing with some of the psychological behaviors, right? So you need a plastic surgeon. It's not a dermatologist. It's not a dentist. It's not a beautician. It's not even a general surgeon who does some plastic surgeries on the side. That will give you a terrible result, right? And it just won't look good, guys. So you want a good plastic surgeon familiar with massive weight loss. So how do I pay for plastics? Now, depending on the area where you live, it will run you between, depending on what you want done, $10,000 to $20,000 US, right? Depending on how much you want done. If all you wanted to do was a tummy tuck and a bat wing removal, that's around $10,000. But it depends. Do you live in Miami? Do you live in Beverly Hills? Do you live in Las Vegas? Or do you live in Albuquerque? I mean, the costs are going to be a little bit different. This will give you a ballpark, and I'm going to explain why this is important a little bit. Are you going to do a full mommy makeover? You're going to get rid of the tummy but you're going to get, your breast done finally, That's okay. Depends on how much you want to spend and what surgeon you want to use. But remember what I told you, even if you have the plastic surgery, it's not going to be the image you have inside your head. And that's why you need some of the other non-surgical stuff, okay? So now let's do some Asian math. I like to do Asian math with my patients, right? Let's do some Asian math. So Asian math means this, because some people are going, Dr. Vuong, that's a lot of money. All right, well, give you an analogy of a car. People will pay $40,000 for a car, $50,000 for a new pickup truck, even $20,000 for a Honda Civic. A Honda Civic will cost you $20,000 these days. And that's just the Honda Civic. And people will pay $40,000 for a car to sit in a car for maybe an hour a day, back and forth to work, run your grocery store. But they won't pay $10,000 to live 24 hours in their body that they're happy with. Does that make sense? So it's a mentality shift about how you view money. This is kind of one of the major points of this talk today. You have to change how you view money. Now, that $10,000, you're inside your body for 24 hours a day, 7 days a week, sleeping, pooping, showering, eating, exercising at the gym. That's a much better investment for you than taking, buying a new car, buying an RV, buying, a four-wheeler. It just drives me nuts when people spend money on stuff that they hardly use. Right? You can spend $40,000 on like a weekend, like a camper that you're only going to use maybe 5-6 times a year when you go on camping trips. That's crazy, right? So think about it that way before you say, I can't afford that. Really? You can't afford that, but you just went and, you did a $5,000 Disneyland trip? Come on now, right? Let's think about that. So let's do some Asian math. If you do, I actually wrote this down. Okay. Let's say you're going to do $10,000. And if you do that if you start saving money, $10,000, and let's say you want to do it for 2 years, that's 730 days, 365 days a year, so that's 2 years. That means you need to save only $13.69 a day in 2 years. Well, Dr. Vuong, I don't know if I've got $13 to save. All right, let's say you want to do it slower. You need a little bit more time. In 2.7 years, that's 1,000 days. 1,000 days. I did the math for y'all. 2.7 years, 1,000 days. That's $10 a day. That's it. So $10 a day will get you to your plastic surgery, right? This is an important part of the talk. Thank you guys for those of you who are still on watching, because this is so important, especially if you're pre-op. If you are pre-op and you understand this, you can start saving $10 a day right now, 2.5 years, you can have your plastic surgery and not worry about it. And I'm going to show you how to do that here in just a second. I got to say something real fast though. All right, $10 a day. That's your Starbucks. If you're drinking 2 Starbucks a day, I mean, Starbucks is $5 a cup of coffee now, right? That's your muffin. That's your, that's like the impulse buy for your little kids. Oh, they want a popsicle. They want this little thing. Your cousin who wants to borrow money when you go out. It is a beer at a restaurant. It's a glass of wine a day. If you just stopped having a glass of wine a day, it's a bottle, it's a cheap bottle of wine a day, and that's it. That's all it takes, $10 a day, right? And then you'll have it. So if you're pre-op and you're nervous about loose skin after surgery, I promise you, you're going to need plastic surgery. Just start trying to save $10 a day. Now, I'm going to show you how to do that. Who wants to know how to do that? Okay. I'm going to erase it up here. So, my debit card trick. This is my debit card trick. This is how you're going to get there, okay? Every time you use a debit card, when you go to check out, here's what I want you to do. When it asks for money back, you say yes. And you ask for as much money as you think you can financially handle. So for some people, it's $5, $10, $20, right? But we're talking about $10 a day. So when you swipe that card, you take, do you want money back? Yes. How much? $10. Okay? You say $10, you get that money, you take it home, you put it in a coffee jar or a safe, and you bury it outside in the backyard. You don't tell your husband about it, you don't tell your kids about it, you forget about it. Okay? And if you will do that, it's bizarre. Like money back. You say yes, $10, and then you hide it. And funny thing is this, you'll never miss it. You'll never miss it. It's bizarre, y'all. So some of you guys are going, but that's easy for you to say. You're a rich surgeon. You forgot my story. I was a broke surgeon. I went bankrupt as a surgeon. 2008, Hurricane Ike went through my practice in Houston that was barely getting by as it was. I didn't take home a salary, for 3 years. And then 2008 wiped me out after the Hurricane Ike. So I was a broke surgeon. And so at one point, I started doing this, and I had to start with like $5. I had no money in the bank. I was like, $5. Okay, I want $5 back. And I started saving it. And oddly, I never missed it. I had 11 creditors calling. I had banks calling me. I had all sorts of stuff happening to me. And I would just say $10. I'll take $10 back. And I hid it in a coffee can. And I never missed it. My light bill was always on. My kids never went hungry. It is, I promise you, it's a law of the universe, right? Luckily now, when I use my debit card, I can take $100. And that's, that took me 10 years to get there, but I still do it, and I still stash it away, man, right? So if you will do this, money back, $10, but here's the key. Don't spend it. Some of y'all try to do this, and then you'll spend it. You'll make the mistake of spending it on like impulse buys or a little snack or a little treat. You'll also make the mistake of telling your spouse about it. If you will do this, your spouse won't know, right? You buy $30 worth of groceries, you ask for $10 back, it only shows up as $40 for groceries. They don't know, right? So you're going to save this up. Now listen, but Dr. Vuong, I can't really afford it. I can't, I'm really barely making it. But trust me, I was barely making it, but I was not making it when I started doing this. And I had to start with $5 back. You won't miss it. Your lights will stay on. I promise you, right? Your lights will stay on. All right. Now the next thing, let's say you've been doing this and you saved it up for $10,000 for two years, and you have $10,000, and you wake up one day and you decide, you know what? I don't need plastic surgery. As it turns out, I'm one of the ones who don't need plastic surgery. Or you say, you know what? I'm happy with my loose skin. Dr. Vuong is right. It's a badge of honor. I'm just going to hold on to it. I'm okay with it. Now you have this $10,000 hanging in the secret bank account. Are you going to be like, well, that was terrible advice Dr. Vuong gave me 2.5 years ago, and I got this $10,000, and I just hate that little skinny Asian? No, man, you're going to be totally excited. You'll be like, yeah, awesome! Right? Now you got this big, windfall of $10,000 saved away that your husband doesn't know about, your kids don't know about. Now you can do something, right? Now you might want to go, instead of spending $10,000 on my plastic surgery, I might spend $10,000 and go back to school. I might spend, my $10,000 and start an online business or take a course or go. Now you're talking about really serious life change. Does that make sense? This could be life changing for you, right? But it only starts with $10 a day. See? And the last thing I'm going to tell you is this, and then I'm going to wrap this up. I'm going to continue this conversation in the Sleep Academy, but the last thing I'm going to tell you is this. When it comes to your life, your plastic surgery, your weight loss surgery, you have one of two choices. Y'all write this down now. You have one of two choices. You get choice one is someday versus day one. Boom. You gotta love that. Your choice is someday I'll get started, someday I'll have weight loss surgery, someday I'll start saving $10 a day, or the choice, today is day one. Day one I start eating healthy, day one that I start loving myself, day one that I get rid of the junk, day one that I quit drinking alcohol, day one that I start saving $10 a day for 1,000 days. Your choice, someday versus day one. Thank you guys for watching this broadcast so much. I appreciate y'all more than you know. It's a touchy subject. I get it. You're talking about your weight. You're talking about loose skin. You're talking about money. And I know I'm going to get some haters, but I love all the haters too. I appreciate y'all very much for watching. All right. Please share the broadcast for me. I hope you got a lot of value out of this. Thank you guys for the hearts. All right.